A few months after my first baby was born, I became obsessed with the subject of childbirth. I put myself through doula and childbirth educator training, midwifery apprenticeships, countless hours of self-educating research. And over 20 years since then, as my kids were growing up, they would say it's become embarrassingly easy for me to talk about reproduction. Childbirth is not an illness. Unhealthy things happen during pregnancy and birth, but treating childbirth as an illness has made maternal health care unhealthy. There are two perspectives to maternal care. There's midwifery and there's obstetrics. Within midwifery, there's a concept that some like to call the mama-baby unit, where the mom and the baby are an inseparable unit. When you treat one, you impact the other. In obstetrics, mom and baby are considered two separate medical individuals. Labor is considered a timetable with predictable results. And when labor starts to become more unpredictable, medical intervention is applied. In midwifery, patience is not just a virtue, it's a medical necessity. Midwifery understands that rushing labor actually can lead to causing a complication. But in obstetrics, complications are not as much of a concern because they have a whole facility full of healthcare professionals, medical treatments. Their whole job is to save lives. But in midwifery, a key focus is in preventing problems before they become complications. If you keep mom and baby healthy, you keep mom and baby healthy, no matter how unpredictable labor becomes. In the 1960s, college graduate Ina Mae Gaskin traveled with her husband on his lecture tour westward from California. Months later, on a growing bus caravan, they landed in a property in Summertown, Tennessee. They named the farm. Along the way, babies were born. In turn, that birthed the Farm Midwifery Center. Unlike hospitals, the center has been very open with their statistics. Between 1970 and 2010, over 2,800 births, 95% of those women gave birth safely without a hospital, with a 2% C-section rate. And vaginal birth after C-section, called VBACs, successfully completed at 96%. Not a single mom died. Stellar statistics. This kind of model of maternal care is used extensively in various places throughout Europe. Since the majority of births are healthy, midwives can easily manage healthy birth. They're experts at it. Complicated cases are managed by obstetricians, often in a hospital. But in the United States, the relationship between midwifery and obstetrics has not been a healthy relationship. There has been conflict almost from the beginning. Midwifery practice and education has been going on for many, many hundreds of years. Obstetrics in the United States is a relatively, comparatively new field starting about 200 years ago. Schools had to be started by upper-class benefactors. Students were primarily white males in degree programs lasting only 2 years, consisting only of books and practicing on mannequins and cadavers. Meanwhile, midwives spent years in hands-on apprenticeship, often with an aunt or a grandmother. Doctors plowed on. As they became established, they began to convince politicians to regulate or restrict midwifery or home birth, a practice that still exists today. By the turn of the 20th century, doctors and their nurses took advantage of the anti-immigrant sentiment of the time, using a print ad campaign in magazines and newspapers, displaying midwives as unsanitary and uneducated. They had their own complications. In the 1980s, The U.S. society had become very invested in lawsuits. Medical malpractice insurance companies became an industry. Obstetricians were forced to participate in these insurance policies as a legal protection against lawsuits when outcomes didn't go well. But the results did not turn out well. Sources such as the CDC, WHO, and World Bank rank the United States as worst in maternal mortality ratios among developed countries and some underdeveloped countries. This model, accelerating starting in the 2000s, mimics a pattern of a decrease in VBACs and an increase in C-section. Also mimics the increase of the medication use of Pitocin, Cytotec, and Cervidil. This is not the results that obstetrics intended. There is so much we can and should do. There are plenty of options. Thanks to the advent of the internet, a midwife is a search engine away. You can find a midwife in just about every major city in the United States. There might even be some here. Midwives are not the only option. Midwives do home birth. They do birth centers. There's 2 here in Tulsa that I know of. There are midwives that work in hospitals, but there's also birth doulas, postpartum doulas, sibling doulas, grief doulas if a mom experiences a pregnancy loss. There's also prenatal yoga classes. There's samples and questionnaires to help you come up with a birth plan. The options are available. We just have to investigate them. We need to spend some time, just like we do when we buy a new house, a new car, upgrade on our new cell phone. Our healthcare is that important. Our current healthcare, especially as women, will drive the rest of our life. And it will drive the life of the future generation to come. It is dangerous for us to keep maternal health care silenced as a footnote in U.S. conversation. We are not too civilized to talk about the most common health event in human life. Thank you.